I want to preface this video by saying I know that every healthcare situation is unique. This is not trying to tell you what the answer is, but illustrate a path, a journey that you can think through. So imagine this. Imagine if we think of the different roles in a healthcare system, from the overall system to providers, clinicians, and technical support. So at the top of the house, we might have a strategic objective like provide exceptional healthcare. To do that, there's a number of things that the providers need to do, one of which is to immediately address patient deterioration. Now, to immediately address patient deterioration, there's a bunch of things that clinicians need to do, one of which is detect that deterioration immediately. Now, to make that happen, there's a bunch of things that technical support needs to provide, one of which is just the ability to maintain continuous monitoring. So this is kind of the alignment or drill down cascade, whatever word you would like to use. And there are several ways to easily build this out. One is sort of from the bottom up. In other words, why is it we need to maintain continuous monitoring? Well, we need to do this in order to get this next step. We need to do this in order to detect patient deterioration. Why is it we need to detect patient deterioration immediately? So that we can immediately address that deterioration. And why do we need to immediately address it? So that we can provide exceptional health care. So that framework from the bottom up is we need to do this in order to get that. Now, it also works from the top down. What that looks like is, to get exceptional health care, we need to immediately address patient deterioration. In order to get immediate patient deterioration under control, we need to detect it. In order to get this, we need to continuously monitor. So top down, bottom up. You can also get to it by just asking yourself why. Why is it we need to do these things? And the ultimate answer isn't the end objective, but for your immediate customers. In other words, technical support's immediate customers are clinicians. Clinicians' immediate customers include the patient, the patient's family, and so forth, but also providers. Providers have a bunch of internal customers and external customers, ultimately the hospital system. So we just need to understand at what level you're serving. Now, we can take these objectives and begin determining what are the activities we need to do to support them. Now, the activities fit into three broad categories. Lagging key results, things that we would see once we've achieved that objective. Leading key results, things that we would see day to day as we're working to achieve that objective. And then initiatives. Initiatives are projects, things that we're doing in order to improve your processes today to make the process better tomorrow. So in this example, we might have an initiative like rolling out continuous monitoring. And I'm doing that project in order to impact the number of beds that are installed with some form of continuous monitoring. So again, when I charter this project, one of the outputs that it needs to generate is changing this key result. Project charter should also always detail what is the key result that will improve as a result of that project, so we can monitor that project and ensure we're getting those benefits. Now, that's a leading key result, and if we have more and more beds with monitoring installed, the lagging key result is the number of inpatient beds with continuous monitoring available. So even though it's installed, it might not be available because we don't have the training, we don't have the capacity, the monitor's been moved somewhere else, whatever that might be. So ultimately, the lagging measure, how do we know we've maintained continuous monitoring? That measure, inpatient beds. Now, this doesn't always happen, but in this example, this lagging key result, how would technical support know they've done their job, becomes a leading key result for the clinicians. In other words, the clinicians need a high percentage of inpatient beds with continuous monitoring available in order to detect the deterioration. Now, this isn't always the case that the previous or the downstream process becomes your leading indicator. It is in this case. The lagging result would be, for example, the number of alarms that are not escalated. So the idea is with continuous monitoring, I can get there sooner. I can figure out whether this actually needs to get escalated or not. And that allows us to detect when there is deterioration that needs to get done. Now, once again, interestingly enough, their lagging key result becomes a leading key result for providers. The lagging key result for them might be something like inpatient census not transferred to some higher level of care. Now, this is important because in order to achieve this outcome, inpatient census not transferred to a higher level of care, they need the capacity. Providers need the capacity that is currently consumed by false alarms. So this way, the number of alarms that aren't escalated, in other words, only the key ones get escalated, allow them more capacity and therefore can deal with things sooner and will reduce the things that go to a higher level of care. And once again, that lagging key result becomes a leading key result for the overall hospital system, and that might be their lagging measure might be something like readmissions. Now, again, I know every hospital healthcare situation is different. I'm not suggesting these are the indicators. They're just indicative. Now, the other way to look at this is often your boss's key result informs what your objective is. In other words, if the key result here is the number of patients not transferred to a higher level of care, that informs the objective of immediately addressing patient deterioration. If one of their key results is alarms not escalated, then that informs an objective the next level down about detecting patient deterioration immediately. So these models aren't true in every instance, but in this example, they happen to give us a framework to think about as you're considering your objectives and your key results. Thank you for your time.